There is a major dengue outbreak in Belize. According to the statistics, there have been an increased number of infections, 230 cases in Orange Walk District, 124 in Corozal, 98 in Cayo, and 105 in Stann Creek. Belize and Toledo have recorded less than 20 laboratory-confirmed cases. Those figures combined, not to mention the undocumented cases, are 20 times higher than the numbers up to this time last year. To break it down even further, there are over 600 confirmed cases of dengue in Belize so far. This is 2 times the amount recorded for the entire year of 2018, and more than the numbers when combining the figures from the past 2 years. It has thrown the Ministry of Health into a frenzy as they try to contain the spread.
So we're looking at laboratory surveillance, looking at confirmed cases. And so we had seen an increase of more than usual at the beginning of the year, but it had been a gradual increase. However, in the last 5 to 6 weeks, we have noticed a drastic increase in the number of cases. As mentioned earlier, it was mostly concentrated in the north. Started in Orange Walk, then it started spreading to Corozal. We had some small numbers in the Keys. However, since we have noticed this increase the last 5 to 6 weeks, we have seen an increase in the southern part of the country, Stann Creek District to be more specific, and also in the Cayo District. There are communities that are, of course, having higher numbers than others.
The statistics show that children between the ages of 5 and 9 and adults up to 39 years contribute to the bulk of those reported with dengue fever. Surveillance Officer of the Ministry of Health, Lerna Perez, says that across the region there have been outbreaks in dengue fever and the deadlier dengue hemorrhagic fever. The increased cases in the south are expected, but the rise in the north and west is transboundary.
We need to look first at the impact of what is really happening in our neighboring countries. If you look at cases coming in from the north, which is where we actually started noticing the increase in cases, you look a bit farther out to Quintana Roo, and actually the state of Quintana Roo is reporting the highest incidence of dengue for the entire Mexico. So you know that we have a lot of movement between the border towns there. And then if you look at the reports coming out of Guatemala and Salvador and Honduras, they're also experiencing a major outbreak at the moment, with Honduras having a high fatality rate related to dengue.
Now, there are 4 different types of dengue that affect humans, and in any given year, there are 2 types circulating. But within the region this year, all 4 types have been detected, which Vector Control Chief of Operations Kim Bautista says can result in the likelihood of having a severe episode of dengue with hemorrhagic manifestation. Considering the rainy season is upon us, the ministry is expecting that the figures will increase.
Disease modeling, looking at trends that they had started seeing late in fourth quarter of 2018. So the region and a whole, they was seeing an increase in cases. So based on those forecasting, they alerted us and told us, look, we're going to see more several outbreaks, or we expect several outbreaks. And so back then we started doing some media rounds. I believe it was in March. So since that period, we have been seeing an increase in cases. But what the ministry did at that time was to basically put the different regional programs in country on alert. We have in place whereby our surveillance and management committees within the different districts have developed their dengue preparedness and response plan.
Kim Bautista is stressing on prevention measures. The Ministry of Health is in high alert, and the vector control units across the country have been spraying and carrying out awareness campaigns on best practices for residents in vulnerable communities.
Dengue is one of those diseases that socioeconomic factors is a big contributing factor. So areas where there's poor infrastructure, drainage, poor housing, and these persons being in those areas, it increases the likelihood of coming in contact with the Aedes aegypti vector. We have 6 district surveillance committees. Those are led by various professionals with public health and vector control, nursing background, medical background. And what they have done is prepared a preparedness and response plan for their district. So that is has a component that has to do with vector control, with lab, with clinical management, with education. And so I'll give you an example. Last week in the north, in Corozal, they had met with 18 village leaders to sensitize them on what's been going on, and to basically engage and start planning things such as cleanup campaigns.
The last time Belize has recorded over 600 cases was back in 2015, but the ministry is concerned about the fact that 7 months into 2019, those numbers have already been surpassed. Duane Moody for News 5.